My name is Eros Smith. Eros Smith, Wake Up with Makeup, which is a logo trademark for the last 25 years in the Arab world and Greece. I've started permanent makeup over 25 years ago in Saudi Arabia, and I have practiced my field extensively throughout the Arab world, in Saudi Arabia, in Bahrain, in Dubai, UAE, Abu Dhabi, Greece, and the States. I can claim, because I have before and after pictures, as many as 10,000 people, and I have as many letters, thank you letters from satisfied clients. My job for me, it is my soul, my practice, my satisfaction, and most of all, the pleasure that I give to all clients to make them feel happier because they see a better face, either throughout cosmetic permanent makeup and medical makeup, permanent makeup. I'm a professional esthetician, I'm a medical esthetician, and Eros Smith permanent makeup procedure is hygienic. Everything is one-use disposable and it's open in front of the client. There's never a possibility of contamination, never ever. Everything is open in front of the client and it's one-use disposable. These are the containers where I will mix the colors for the eyebrows of Maria. The needles are one-use disposable and they are opened in front of the client. It's inserted in the machine. The cap that goes over the needle is also disposable for more protection. So the client is prepared and confident that everything is done in front of her for her and her alone. Everything is disposed right after the procedure in special containers. And here we go. Colors are mixed in front of the client because it's essential for colors to be blended together, and that is why Eros Smith Wake Up with Makeup procedure for eyebrows or eyeliners or lip liners or full lips or for medical reasons, they do not change color and they do not go away because colors are mixed always. It is very common that most colors change if they are used directly from the bottle. Black becomes green or gray or blue. Brown becomes orange or purple. And that is the very, very common mistake that professionals or practitioners for permanent makeup face all the time, because simply they do not know how to blend the colors. Colors are already mixed and ready to go. This is a beautiful brown for Maria's eyebrows, and I always tell the clients what it's going to be today and what's going to be after about 10 days to 2 weeks, because you must remember that the colors in the beginning for 2-3 weeks may show a little bit darker because the body fluid with the color becomes crusty. So when it's crusty, it looks darker. After about 2 weeks, the color loses about 20 to 30% of its strength. And although in the beginning we have a dark brown, after about 2 weeks, we're going to have a beautiful lighter brown that will match Maria's eyebrows. Do you see it? Okay. During the procedure, I tend to change gloves a lot because, as I said initially, hygiene for me is the A to Z in the whole procedure, apart from the ability to do perfect job. Usually, I do not design the eyebrows, although previously I have already explained to the client what I do, and many times I will show them with pencil what I will perform, what I will do for them if they have questions. And since we have discussed it already with Maria, I will start, because I work freehand. I am a professional medical aesthetician, but I do, when I see somebody and it's a charisma, I call it a practice charisma. I see what suits everybody and I will advise them accordingly. I will use the hair stroking technique for Maria, and I will start now. I have already applied anesthetic cream. Anesthesia has already been applied on Maria's eyebrows to make her feel comfortable and not in severe pain. Always exchange the tip of the Q-tip. Never contaminate the container with the same Q-tip for both sides. Anesthesia is usually left on the eyebrows for about 20 minutes to half an hour, and then it's removed and we proceed accordingly with the actual procedure of eyebrow hair stroking permanent makeup. Now I am removing the anesthesia. And I will start the procedure. As I previously said, I have already discussed the procedure with Maria. And I'm certain she's not even uncomfortable at all, because I have already used the anesthesia. I work in hair stroking techniques. In her case, following her own design of eyebrows, just thicken them a little bit more and make them more appropriate for her face. I work little by little. And I wipe as I go along. There is no pain. Do you have any pain?
No, no.
Not at all. I wipe. The color is already starting to be inserted in the upper layers of the epidermis, and as you can see, not even a drop of blood. This is the magic of Eero Smith Wake Up with Makeup. You see, with just one passing through, already colored and started to get inserted into the layers of the epidermis. Buenas, María. Beautiful color on her face. This is going to be magnificent. Are you confident, Maria?
Mm-hmm. Very much.
No discomfort at all, right?
I don't
Feel
understand anything. I don't feel anything. Because of the cream, and because of your very light hand.
Thank you. That's better.
It really light your hand, and you know where you put it. That's why your hand runs very, very fast, exactly at the same, at the point they must be. That's why I came to you.
Thank you very much for trusting me. You and 10,000 people already, and I hope I'll live for a long time to perform miracles to so many people, because it's so much satisfaction to me that I can beautify ladies' faces and perform wonders for cosmetic reasons and medical reasons as well. Because permanent makeup applies to eyebrows, to eyeliners, to lip lines, to full lip, to alopecia for people who have lost their eyebrows due to medical reasons.
This is the most important that you make.
Yes.
That you do.
For people with burns, with scars, with corrections from horrible different jobs that people perform on others and destroy faces and the psychology of some. For ladies with breast cancer, you see the detail? Do you see the detail? Do you see the detail? Ladies with breast cancer, I put the color on the areola. It's called areola breast restoration. And although I cannot show it in public, I will show you pictures and you can understand what I'm talking about.
That's why we all wish to be for a long, long time. To help people.
Yes, that is one of my purpose in life, to make people happy. And through my expertise, I can really promote the well-being of others by interfering lightly on their external look. Because external beauty affects the psychology, and it either makes people unhappy and miserable or makes people happy and elated. I just leave the color only for a few minutes. You see? I can alter the looks of the eyebrows. I can change them. I can add, I can delete, I can do anything we feel it's necessary to frame the face beautifully. Because eyebrows are the frame to the face. And without eyebrows, there's no face. It's like you have a beautiful picture, but if you don't have the right frame on it, it loses its value and its beauty. There are various different techniques for creating eyebrows. One is a hair technique, like this, more or less. There is the full technique where, particularly in Arabia, women really like. We call it the bold color, which I don't really like, but I do it, and I do it beautifully because it satisfies certain people and certain cultures. And obviously, me having lived in the Arab world for more than 35 years nearly now, I respect what people like. And although I have and will turn people away if I don't necessarily agree with the design they choose to have, I will do what it is correct for them, and at the same time please myself for doing this job and please them as well. I'm going to stand now. I have my procedure that I work. When one lays down, the muscles change. So it's essential that you look at the person straight forward and get them up, and you will see in a minute what I'm talking about. So before I complete the procedure, I always will stand the person, sit them opposite me, and make sure I look at them straight forward. If the person starts to feel uncomfortable for any reason, because of the skin, because it could be a little bit uncomfortable, slightly uncomfortable sometimes, I stop and I reapply cream for a few minutes. The procedure can take from 45 minutes to an hour and a half, depending if I have to stop to reapply cream, or if the person is comfortable, or how thick or thin or change of shape they want their eyebrows, or what has to be done. The hair technique is very popular. The hair stroking technique is very popular nowadays, but I have been practicing this technique for more than 25 years now, since I started doing permanent makeup. It was the people did not, practitioners did not know this technique, neither did patients ask for it. But my eyebrows never looked excess and never looked really artificial. So when people ask me and they say, "Oh, do you know the hair technique?" And if it's in front of some previous clients, the clients will say, look, what are you talking about? You're always doing this for the last 25 years. Anyway, trends change, styles change, desires change. So we have to work accordingly, but always with the ethical and clean procedures that will give us perfect results and happy clients. Less than an hour later, voila! Here are Maria's eyebrows, freehand, nearly perfect. I always like to say nearly perfect because I must see her about 2 to 3 weeks later. I never consider my job 100% finished until I see her again, because once all the darkness is gone and you will be able to see the perfection, then we'll decide if we need a touch-up or not. Most of the time, my clients do not need a touch-up. Sometimes they do because I choose to do it because I need absolute perfection. And that's what makes me unique in my trade. Detail to perfection. Come closer, please, and look the right after. Hardly any swelling, hardly any irritation. Of course, as I mentioned earlier, they will be dark for about a week to 10 days, slightly dark. And then, once the initial 20–30% is gone, you will have the perfect eyebrows that will frame and save this lady's face and make her look younger and happier and more finished in her whole overview. Did you feel anything, Maria? How was the experience for you so far?
Thank you very much, doctor, because for me, you are not only a beautician, you are doctor first, because you have the perfect hand. I didn't realize anything. So, as a little, how do we say
Eyebrow
this?
tweezing?
Brow tweezing.
Eyebrow tweezing.
Exactly. Now, of course, I'm satisfied because I saw my face totally different.
Only better.
Totally different.
And this is nothing yet. This is just the beginning. Wait until you see it a week, 10 days later.
Of course, I'm waiting for this, but I saw it from the beginning that my face changed. Of course, changed positively.
For the better. Yeah.
Yes, for the better.
Please zoom in closer so you can see the detail, the right after detail. Okay? And I call this hair stroking, but not the hair stroking that I see sometimes that makes me angry. The one goes one, 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 and it is more artificial than actually the ball color that's produced sometimes from technicians. See it here, see it now, see it here, see it now, and then we will see it a couple weeks later. And as again, I'm wiping, there is not even a drop of blood. We will put antibiotic now, because you must use antibiotic just to prevent any whatsoever problems for about 2 days. And then we use another cream, Bepanthen Plus, for about a week to keep them moist so they can heal beautifully. It is also essential that you do not use much soap or water. When Maria will wash her hands, she will pat dry the area. Do not rub, because we don't want any crust, any dryness that will develop on the eyebrows to be removed prior to the healing, until the healing is totally completed. Now we will proceed with the eyeliner. We will also show you how the eyeliner is done. The eyeliner starts as following: by applying local anesthesia on the lower lid. Since Maria and I decided we're going to do top and bottom, keeping the eyes open for a couple minutes while the anesthesia is applied. On the lower lid first. Because without anesthesia, I must admit, sometimes can become uncomfortable. Okay, Maria, now you may close your eyes, please. So, exactly. And do not open. And I will apply the anesthesia on the top as well. This will stay for about 20 minutes to half an hour. And when we are ready to start, then we will prepare the eyes and the skin around it accordingly with drops. And voila, we will wait for about 20 minutes to half an hour at the most. Okay, cut.
Okay.
Wait there, I'll tell you when. Now we will start. Can we go now?
Yes, ma'am.
Okay, now we will start Maria's eyeliner. I removed already the cream. Keep your eyes open, please. And I will start with the lower lashes first. We decided to do top and bottom for Maria because that looks best for her face. We want to make her look softer and younger. Again, there's no bleeding whatsoever. There's no pain now either. Do you have any pain, Maria?
No.
No pain at all. Open, please. Keep your eyes open. Even if she moves her eyes, there's no problem at all because I'm pulling the skin. So even if she closes her eyes, there's no problem whatsoever. A lot of people worry that the needle may go into the eye, but after 10,000 people, I can claim that nobody has ever got up without the job being finished. Look up, please. Or my needles ever have been inside the eye. Look up, please. Look up, please. Okay, come closer, please. Look up a second. Come closer. Do not pull your face away from me. I will wipe now, and you will see even after the first application how precise and how beautiful the line is. Any pain or discomfort, Maria?
No.
Look up, please. Look up. Keep your face steady, please. Okay, let's wipe. Look up, please. Putting a drop of the antibiotic cream to make her feel comfortable before I proceed with the top. Look up, please. Open up your eyes and look at the camera so he can take a picture. See how the line is already formed? Look up, please. Okay. We're going to go with the top now. Close your eyes, please. I will work as close to the lashes as possible. So we'll make Maria look like he's got more lashes. Open your eyes, Maria.
And rolling.
Permanent makeup is the best thing you can do to yourself. Wake Up with Makeup by Eero Smith. Look at this one. I am the first one. I was my first client of my own self. 25 years later, and look at this. Permanent makeup that stays, looks perfect at all times. Eyebrows, the same thing. Wake up with makeup. Just a little bit of mascara, just a little bit of lipstick, And here you go. I am the best example. Thank you. And just 2 hours later, eyebrows and eyeliner. You will see the results in about 10 days. And you will be able to tell what is permanent makeup by Ross Smith, Wake Up with Makeup. And this is Maria 2 weeks later. Wake Up with Makeup by Ross Smith. Permanent eyebrows and eyeliner that looks perfect all the time, natural, make you look younger, save you time, and you look perfect. Wake Up with Makeup. Ross Smith, Wake Up with Makeup.
I am here to see the perfect result. And another reason that I am here is to thank from the bottom of my heart this lady, the doctor with gold finger, Missy Ross Smith. She did the excellent work. That's why I am so satisfied, and I want to thank you, and I want to propose to all of you to come to visit her, to see from near her gold fingers. Thank you very much.